Thanks, Taylor. Conversations surrounding mental health have become increasingly important to have. And with today's guest, we're going to get to hear about how mental health impacts communities of color. Joining me now is Andrea Brown. She is the Executive Director of the Black Mental Health Alliance right here in Baltimore. Thanks for joining us.
Thank you for having me.
Tell me about your organization.
So it's interesting. The Black Mental Health Alliance has been around almost 38 years. So we're not new to this work. But what we are finding with COVID and heightened racism that we can see every day is that people really are needing a safe space to either have the conversation, recognize there's an issue, and then our hope is to be able to reduce the stigma.
What types of resources do you offer?
So we have what probably second to none, a database of culturally grounded, culturally competent licensed clinicians and we have access to the database for the Black Psychiatrists of America. And so we really do have a wide range. So not just here in the DMV or here in Baltimore, but across the country, we're able to pair people.
Is that something you're trying to recruit for as well because of the underrepresentation in those fields?
I think some, but more importantly, just heighten the message around the importance of mental health. And so while we're excited that this is National Depression Month, we know that it's all year. It doesn't sleep. Helping people recognize the triggers is such an important component to this, and really helping young people understand the importance of mental health and wellness.
Are there different struggles that communities of color face when it comes to acceptance of mental health or access to mental health that you see a disparity in with other segments of the population?
Absolutely. And again, it goes back to, the systemic issues around racism, the notion of don't talk about it. And so we see that often. And so part of what we're trying to do, again, is reduce the stigma, make sure that access is available to people of color and communities of color. And it can't be at the very end of an issue, of a tragedy. So we're talking about how do we get in front of mental health issues? How do we get in front of depression? What does that look like?
In Baltimore, what do you think the most prevalent issue is when it comes to mental health?
There's so many. I think it's not unique to just Baltimore. We see it in urban communities around the country. I think, again, the unlevel playing field, without a doubt, violence doesn't help. And our inability to address those issues don't help. But what is exciting about Baltimore is that we at least have the conversation. We do it through Healing City. We do it through some of our partners with the Healing Youth Alliance and some others. And so we really are able to change the conversation around mental health and wellness.
And so if someone's watching this right now and they are inspired to get help, what should they do?
So one of the things that we would tell them immediately is to, if they can, to call us. They can always call the hotline, but they can call us at 410-338-2642. We're on Facebook at Black Minds Matter 1. They can reach us at BMA Official, but they can find us, and we are a resource for them.
Fantastic. Andrea, thanks so much for joining us this morning. Really appreciate it.
Thank you so much for having me. Take care.
You are very welcome. And